Then where did you get the inspiration to start Lifespan?
It was there in my mind, why don't I get into this?
Can you take us through that development process?
If you see, Lifespan today is one of the most hygienic plant in the country. We developed more than 50 products in sports. And today, if you see, we have developed 750 products.
How did you manage to get all this right?
We have an own R&D team, we have our own QC, and we have in-house QA. So everything is managed by ourselves.
What made you get into a business like hospitals?
It's like COVID. The COVID has come because doctors were not available. Everybody is so busy. My employees itself fell sick many times in COVID. Then there was nobody to help much. So I thought, why don't we have an hospital? That too, an affordable hospital which can help everyone.
Where did you move next, sir?
I was a sports person. I used to play cricket. I wasn't for the district captain. I also played for state cricket.
Was it a deliberate decision to start?
There are a lot of learnings, there are a lot of lessons.
Victory, defeat, leadership, sometimes disappointment.
But unfortunately, I could not do that. Today, I've been appointed as a Telangana president for Rugby Association.
So how did you land up the HR job? Why was that?
I was never behind money. I was always behind the work. Money is not the sole essence of life.
Welcome to Conversations, an interview with legends. Usually when we talk to business people or entrepreneurs, they have a set story. Sometimes that story doesn't change, and most often it changes. Today I have with me a self-made entrepreneur who started on his own without anything to fall back on, but still made a mark for himself and continues to make a mark for himself. I have with me Dr. Narendra Ram, founder of Lifespan, and we'll get to know from him as to how his journey was. Where did he start? What did he do right? Where did he get it wrong? And how he made the course corrections and where he is right now. Welcome, sir. Namaste.
Namaste.
So start with any basic question I start always with is your early days. Where were you born? The schooling, your parents, your siblings. Can you just talk us through that?
Yeah. First, welcome to Lifespan, Suresh Garu.
Thank you.
I'm very happy to meet you after a long time.
Yeah, I think we last spoken before COVID.
Yeah, before COVID, exactly. Thank you so much for being here. I was born in a place called Bhimavaram, but brought up in a place called Prodhutur. It's a very, very small town in Andhra Pradesh. My dad was a government servant and my mom was a housemaker. And I have two siblings. I have one elder sister who is also a homemaker, and my younger brother, he is also a first generation entrepreneur. He is Mr. Sharanya Ram. He runs his own B schools and an IAS academy in Hyderabad, and he is known for his personality development training programs.
Wonderful.
Yeah.
So when you're saying, most of the entrepreneurs who start their life from small towns, when we say small towns, literally small towns, but over the period of time, you graduate to bigger things in life. So from Prodhutur, where did you move next, sir?
I moved to Hyderabad after my schooling. My entire schooling was from Prodhutur. Then later, after my 10th grade, I moved to Hyderabad for my college here.
So where was the college, sir?
The college was in Wesley here.
Okay.
But my entire schooling, if you ask me, my entire childhood was more in playgrounds than in the classroom.
So you are a sportsman.
Yeah, I was a sports person. So I was very much keen into sports. I used to play cricket. I represent for the district captain. I also played for state cricket. So that's where my entire journey is more into playground than classrooms. There are a lot of learnings, there are a lot of lessons in playground than classrooms.
So when you say, because often sports bring with a lot of things, victory, defeat, leadership, sometimes disappointment. All these things come into sports. So when you started your journey as a human resource executive, and was it a deliberate decision to start with that sector in the first place, or was it by accident?
No, actually what happened after my schooling and all that, I could get colleges through the sports quota. That's one advantage which I had from my childhood. Where I got my seats is based on my sports quota. So always sports has been my core interest.
So when you say sports, did you ever think that you should continue with sports as a career, or was it only a kind of a pastime?
Yeah, in fact, I wanted to continue sports as my career, but unfortunately, I could not do that. I've become an entrepreneur today. And but being an entrepreneur, I just didn't leave sports. Today I own a sports company. Okay, I do justification for sports. Today I've been appointed as a Telangana president for Rugby Association.
Okay.
So I do my best for sports all the time.
Wonderful. So when you talk of your journey from the tour into a school and then into college in Wesley, and then obviously that first job is always a landmark thing. You know, people learn a lot from the first job.
Yeah.
What were the things that you learned as a human resource executive, and what was that company all about?
Yeah, actually, after my MBA from IPE, that's called Institute of Public Enterprise from Usmania campus. So I think we were around 60 students those days. So out of 60 students, 3 or 4 people didn't get the placements. I was one among them.
So you're lucky.
So I was one among them, and there were almost 6 to 8 months or more than that I was free. I didn't do any job. I didn't get any job. I was just spending time with my friends and all that. So one day my dad called me and spoke to me. He's a very strict dad.
Okay.
Those days we used to hardly talk to a father. So one day he called me and made me to sit and asked me, what are you doing now? I said, I'm not doing anything. So he said, see, what all I earned till now, I have spent for your education. This is the best what I can do. Now I have retired now. So I will not be able to support you anymore. And you need to stand on yourself and you need to become independent. So that's the turning point in my life where I realized that, then I should start working and do something in life. That's the key turning point, I would say.
I think most parents are like that. In fact, even my father used to give the same advice to me and my siblings also, saying the only thing I can give you is good education. Beyond that, I cannot do anything else.
So one more small incident which I want to share with you. Since my father was in a government servant, so a lot of friends used to think that my dad has made a good money. Okay, they always used to comment that your father was in a good position in government service, so he must have made a good money for you guys. But we have realized when the day he called us and made us sit and tell us that I have not earned anything, I've just earned for your education. Now this is a time you have to start working yourself. Then we realized that's not right and we should start working by ourselves and make our career.
So how did you land up the HR job?
I was looking for opportunities after my MBA because I was almost free for 8 to 9 months after my college. So luckily I got a call from HYBIZ Consulting. That's a startup company those days. Now it's one of the best HR outsourcing company in India. So I went for the interview and I attended the interview, and my boss told me one thing: you have selected Naren, but you'll not be paid for 6 months as a trainee.
Why was that?
Then I was really surprised and I was a little upset. Okay, because because as a trainee you expect something or other.
Yeah.
So then he said, "No, Naren, see, this is the age you need to focus on your career. You need to focus on your career, not on money. Money is not the sole essence of life." That's what he told me those days. That made a big impact on my mind. So he always says that, Naren, this is the age where you need to start learning and concentrate, focus on your career, not on money. Money will be a byproduct. It will automatically come to you. So that impact, even today, I still continue that. I always feel that there's something bigger is going to come for me. So I was never behind money. I was always behind the work.
So those 6 months, was it a great learning experience for you?
Yeah, I've learned a lot from HYBIZ Consulting, especially from my boss. See, it's always important with whom you're working is what is important for me. So I learned a lot because I was personally reporting to me and he taught a lot in HR. Sometimes I feel maybe I would have spent more time because I worked with very less time with him, actually, around 1.5 years with him. But if I had worked maybe 3-4 years, I would have learned much more than what I've learned today.
You also forayed into media, and with Power Politics, a magazine that still sells very good and still is widely read. Why was it that you wanted to get into media in the first place? Because media is a field that is good, but highly risky in terms of advertising revenues or whatever it is there. How did you manage to get into media in the first place?
So media is I met one of the most renowned journalists called Mr. Harjay Singh those days. So when I met him, then he was very good at writing, but he was not very good at marketing the magazine, what we used to run those days. So he requested me if we all can together work and do something big in media. Then I was very young that time, so we had a couple of people around us. Then we thought, let us start media and do, if we can, do a justice for people, for the society. We started just investing. The first investment was that, getting into that magazine called Power Politics those days, and learnings from Harijay Singh also was very very good for us, because he's a one of the most senior most journalist in the country.
So when you're talking of a magazine, first was HR, then the magazine. Then where did you get the inspiration to start Lifespan?
Yeah, lifespan, that's a good question actually. So the lifespan, since I'm a sports person, I used to love sports like anything. In my school days, when I used to play cricket, my father used to get protein powder and multivitamin tablet. When I was in 7th, 8th grade, I'm talking about. So those days he used to tell me, be very careful, not even one spoon should fall down.
Okay.
The protein powder.
Don't waste anything.
Don't waste anything. Okay. Then I asked him, why is that? He said, it's very expensive, number one. Number two, you don't find in India. So he used to procure this from abroad those days. So we used to have it 6 months. Like once we get the tin of a protein powder, we used to have 6 months very carefully. Those days I used to think, why can't we make this? What is there in this? Why we can't make this? Is my first question always.
This was which year, sir?
That should be 1993, 94.
Those are the early days before liberalization.
Yeah, exactly. So that's where always that my mind. So once things moved on, once I started getting into entrepreneurship and business, then it was there in my mind. Why don't I get into this? And I thought, why don't I establish one of the best manufacturing plant in the country? So if you see, Lifespan today is one of the most hygienic plant in the country.
Good manufacturing practices and everything there.
Yes.
So when you talk of Lifespan as a product, you started with you're talking from a perspective of plain protein powder now, but you expanded your scope. There's so many products under your umbrella today.
Yes.
Can you take us through that development process and how you evolved each one of them? At least the major products.
Yeah. See, when we started Lifespan, my major focus was on R&D. R&D, we invested a lot in R&D. We bought a team about 8 to 12 people in the beginning itself. Okay, and we started with sports nutrition. Since I was into sports, I like sports, so we got into sports nutrition. We developed more than 50 products in sports. Well, let it be powders or tablets or liquids. We developed more than 50 in a span of 1.5 years. Then slowly we got into Ayurveda, then nutraceuticals. There are so many other products, immunity products that we started developing. And today, if you see, we have developed 750 products.
Wow, 750.
750 formulations in Lifespan within a span of 5 years.
I mean, when you talk of R&D, because these all come out of pure R&D efforts, that means you need to involve scientists, maybe
Yes.
other people, everybody into it who know the business. Now, one aspect is to do the R&D. Next aspect is to maintain quality control. As an entrepreneur who was not in this business before, how did you manage to get all this right?
Yeah, one advantage what I had was, we have an own R&D team, we have our own QC, internal QC, and we have in-house QA. So everything is managed by ourselves. We have the teams in different departments. Because generally what happens, people who manufacture production, they outsource for R&D, or they may outsource for a QC or a QA. But whereas in Lifespan, we have our own production, R&D, QA and QC, all are together with us. So that's one advantage which we had.
When you talk of from a perspective of making products, 750 odd products, now that's too huge kind
SKUs,
of portfolio
yeah.
you have.
Yes.
How do you maintain a grip on all this? I'm sure you have a great team. That is why it is.
Yeah, we have a very good team, and also we do a lot of softwares are there which we manage through the softwares. As I understand, SKUs or 750 managing is very, very difficult. Okay, but since we have a good team, we are able to manage well.
Now, are you happy with what you did? I think you wanted to grow from there.
Yeah.
Lifespan as such, in terms of a lifestyle product, if you can call it, it has the same 4 words, 4 alphabets to start with.
Yeah.
But you wanted to get somewhere else. You also wanted to get into hospitals.
Yes.
What made you get into a business like hospitals, where the domain expertise is really a crucial thing? Most of the hospitals are started by doctors.
Yeah. So actually starting the hospital is with my personal experiences, what I went through in a couple of years. If I have to tell you an example, what made the thought has to come into my mind
Yes, sir.
was initially there was one day I been to a corporate, very big corporate hospital in Hyderabad. Okay, I went around 10 a.m. in the morning, and it took 20-25 minutes only at the billing counter. Okay, from there they guided me to go to the doctor's room.
And this was an OP.
Yeah, this is an OP. Yeah. So
Okay.
from there, I went to the doctor's room. I was trying to identify where the doctor's room. It's quite big hospital. It took another 5 to 10 minutes for to reach where the doctor sits. Then after that, they made me to sit for a while, and it was like 11 o'clock, 12, 1. The doctor is too busy, too busy. Of course, he's a very renowned doctor. I will not say that it's not easy to meet that kind of a doctor. Okay, he's so busy. So it took for me till 2 o'clock. 2 o'clock, I met the doctor, and he spent 2 minutes with me. That's all, 2 minutes with me. Then fine, okay, he has written prescribed some medicines, and he has prescribed some test. After the doctor prescribed the medicines and the test, I saw it is 35,000 is the bill. Then while I was coming down from the steps, I realized if it is a common man, what would be the situation? How can he pay 35,000 bill for just 2 or 3 tests? So that's where actually I thought we should start some affordable hospitals in Hyderabad. And that's where Lifespan actually started. And few more experiences like COVID. COVID has come, and because doctors were not available, everybody is so busy.
Correct.
My employees itself fell sick many times in COVID. During COVID, then there was nobody to help much. So I was trying to reach a lot of friends. Even they were very busy to attend the calls and all that. So I thought, why don't we have an hospital? That too, an affordable hospital which can help everyone. At least middle class families is what I was there.
So how did you start? I mean, what was any hospital requires a lot of capex.
Yes.
In terms of, then of course you have your manpower in terms of doctors,
yes,
nursing, paramedics,
yes,
technical staff, everybody. So as an entrepreneur, naturally, if you're putting X amount of money, you expect something to come back, or at least an X plus to put future expansion. Yeah. So were you able to get this business model right?
Yeah. So what we did initially, then I started working on how to start the hospitals. Luckily, I have a good PR. Doctors.
There's no doubt about it.
Yes. Okay. So I started meeting doctors, and luckily some of my cousins were there as a doctor. So I started talking to them. Then they got me some opportunities which are sick units. We thought we'll start with the sick units and take over the units and start developing it. Instead of we setting up the hospital, it may take long time. So we started identifying sick units like hospitals which are there in Hyderabad. And today we have established 4 hospitals in Hyderabad, places like Shapur, Chintal and Gudlapochampalli. And we are not going to stop here. This year we are planning about 10 hospitals to set up in Hyderabad.
So how many beds do you have right now?
We have 100-bedded hospitals.
So all the 4 combined have 100 beds?
Yes. No. Each hospital is, 2 hospitals are 100-bedded hospitals. Okay. And 2 hospitals, 50-bedded hospitals.
So technically you have 300 beds today.
300
but I'm sure you're expanding, as you said.
Yes.
In hospitals, as you said, your dream is great in terms of providing service. You want to provide at a lower cost, and you're set up in places which usually don't have big hospitals, like Gundalapochampalli or even Chintal for that matter.
Yeah.
After you started running these hospitals, what has been your experience in terms of interacting with patients? I'm sure you keep meeting them regularly. What has been the feedback from people?
So one thing what I observed is, 2 things are important in a hospital. One is doctor, the second is service. So I was lucky to get good doctors, and also lucky to have the doctors taking care of the services, because I've invested, but I don't take care day in, day out of the hospital operations. The doctors whom I have today are really good. So that's where we've been successful today, and trying to bring more hospitals into the Lifespan brand.
So basically you are building up doctors as entrepreneurs.
Entrepreneurs, exactly.
So that they own the space, they own the hospital in technical sense.
What we do is we give certain shares to the hospital doctors. Okay. So the doctors own certain share, and I own certain shares. So, but I run the show as a chairman of the
So there is a
organization.
sense of ownership among the doctors.
Yes.
They don't just look at it as a job
Yeah.
per se. Great. Now, when you talk of a hospital, we went from lifespan, we went into hospitals, and then there is N Sports, which you earlier spoke of it briefly.
Yes, yes.
What was N Sports concept all about?
So sports is always very close to my heart, as I
Yeah.
told you, because I was a cricket player. I was a sports person. I was in the schooling also, I was a sprinter. I was 100 meters, 200 meters, 400 meters and long jumper. So I played for districts.
Okay.
So I have that love and affection towards sports. So I started this company in sports, and we started building, supporting a lot of rural areas, students from rural areas.
Okay.
We pick up students from there and we start supporting from them. From there we actually started. If you see now, today I am the Telangana Rugby Association president. So we are aiming to pick up students from rural areas and
So-
try to develop them, and who has the determination to do something big.
Yeah, in fact, India has a lot of sports personalities who have grown over the last decade.
Yeah.
We never invested in people before. We had some traditional sports like hockey or wrestling or weightlifting, but today India has gone beyond that. We are very good in shooting. We are very good in field sports. We have Neeraj Chopra, like people in that. And there's also government coming up with various schemes. We have a lot of money being invested in coaching and all that.
Yes.
So in terms of building sports person, great idea to get them from rural areas. Do you have a formal setup where you do all this training and everything?
Yeah.
Or is it kind of they train in their own places?
No, we have nominated district in charges. So almost 32 districts we have in charge who take care of these kids. So they bring them to us, and we have competitions regularly which happens in Hyderabad. So we identify people, students from there, and we try to push them to national level.
Okay. So when you talk of sports, hospitals, and lifespan, as a boss of all this, as a founder and chairman or whatever it is of all this, do you think there comes a time when you need to start delegating? I'm asking from a management perspective.
Yeah.
The art of delegation. What is
Yes.
it that you have learned when running such a vast amount of
See,
business?
today, if you seriously ask me, I don't run anything. It's all my team who runs the show.
Okay.
So I totally depend mostly on the team. I try to develop my team. Wherever I sit today, because of the businesses, we have invested today more than 14 companies. So everywhere we have people who take care by its own. So what I've learned or developed last 10 years or 15 years was the team.
So the team as such depends on the boss. Okay, the motivation that you give, the kind of freedom that you give them to operate in.
Yeah.
Quite often we have seen there are bosses who micromanage,
Yeah.
and there are bosses who let go, and there are some people in between all this.
Yes.
Where are you as an entrepreneur?
No, we have decentralized our system.
Okay.
So everybody has their own power, because we run with a system, we run with a policy as a company, because we are into corporate world. So we run with that policy making system.
So you usually when you have products like what you have with Lifespan, you usually bring in some film stars or people like that.
Yeah.
Big names so that they can start promoting the products. We see that in real estate, we see that in consumer products everywhere. In terms of running or rather building the brand at what you do in Lifespan, you have not used them. You used sports as a concept. Is it because again that you are more attuned to sports that you want to promote these people?
That is one thing, but actually if you see, every company has their own strategy of making the business. Okay, if you take actors or actresses, I'm sure the business will be very aggressive. You get a lot of sale very fast, quick sale. You can see very quick sale in actresses and actors. But my love towards sports always says that I need to develop people who are from sports background. So, and also I always feel that, why don't I take somebody who played for India, who represented for India. So Nikhil Zareen, the world boxing champion, was our brand ambassador. Now the Olympian shooter, Isha Singh, was our brand ambassador. And apart from that, there are a lot of budding athletes who are there with us, whom we are promoting. Like I own Visakhapatnam cricket team. So KS Bharat, who played for India, also works for us. And Ashwin was there with us. So there are a lot of budding athletes who are there, sports people who are with the part of Lifespan today. So I feel they should grow along with lifespan. And I'm not looking at where, very aggressive kind of a sale where you need to make very big overnight. What I was looking at is organically we should develop. We should not develop very, inorganically. That's what I always feel.
So acquisitions are always on your radar?
Yeah, sorry?
You want to acquire more companies as you go along?
Yes, we are still working on different other projects, because in education we have a different models. In healthcare we have a different categories now, because we got into prevention healthcare, we are into hospitals, we are getting into pharmacies. So the different segments that we are working now.
So you're working on. You also, at the end of the day, when you talk of your charity and other things, you have been contributing a lot to the NGOs that are there. But you started your own foundation, the Field Foundation.
Yeah.
What was the thought? Because if you want to donate to NGOs, that is the easiest way to do it. But to run a charity of your own, rather an NGO of your own, what was the thought process behind it?
So it's always that, once I make money, I understood that it is not just me that I should be happy always. We should also make some of our people also happy. So the society should be happy. That was there always in my mind. So I thought, why don't we start my own, instead of giving to some other charitable trust. I thought, let me start my own charitable trust, and 10 to 20% is what we divert from our profits to our charitable trust.
Well, that's huge, because usually the government of India mandated thing for a CSR is just 2%.
2%, yes. Because we don't go to any corporates for doing these activities. The entire funding is done by our own group.
As an entrepreneur, Mr. Ram, at the end of the day, everybody would like to be known as something. So if you take a Ratan Tata, or if you take the Birlas, if you take the Ambanis or the Adani, anybody or the big names, they all like to be remembered for something they did to the society. You have done a lot of work on the NGO side. You're promoting sports persons. You're making products which can help get a better lifestyle for people. But as an entrepreneur, if somebody asks you who Ram is, Ram Namuri is, who is he kind of thing, who Narendra Ram should be like to be remembered as, what would you say?
So if you ask me seriously, I feel that he's the person who has done something big for the society, something good for the society, and he was always there to be,
But is that because somewhere along the way, we leave the stamp and say, not just as somebody else talking about us and say, this guy built great brands, for example. It's not easy to build brands, by the way.
It's not easy
You know
to
it
build
very
brand.
well.
Yeah.
Very tough. And even if you build it, to retain it is even more tougher.
Yes.
Now, when you talk of your quality products, when you come back to and look at your 750 odd products, in terms of retaining market leadership and in terms of ensuring quality, you must be surely kind of having your hands on that part of it.
See, coming to the brands, every company has their own, every company has their own space, I would say. So, like lifespan, if you take, for example, Patanjali have his own space of market. Okay, and if you take Amway, their model itself is very different from us. So their segment is entirely different from where they sell and how they sell. Okay, we are into traditional market, so we have our own space. So I feel everybody is doing their best. Today, the space of nutraceuticals in India, the market size is around 25,000 crores. So I think it is expected to be double by 2030.
That is because people are seeking more natural, organic lifestyle products?
Yes, people want to get into preventive care. That is one of the major thing. People started realizing more after COVID, because the business, what I've seen before COVID, the business after COVID, there's a lot of difference.
In fact, we speak like that. It usually used to be, BC and AD before.
BC
now
and
it's
AD,
before COVID and after COVID.
Exactly.
That is what happened. So in terms of COVID taught us a lot of lessons.
Yes.
Okay. One, that we don't need to come to office. We can work from home. Second is in terms of even healthcare. We can do online consulting. Not everybody needs to come to the hospital. The doctor need not touch and feel the patient often, but it has changed.
Yes.
But in terms of a product, as you rightly said, before COVID, it was different. After COVID, how different was it?
So before COVID, people doesn't have so much of awareness that today they have. If you ask me the difference before COVID and after COVID, I would like to say you an example that there is a product called Giloy. It's an immunity-based Ayurveda product.
Okay.
Okay. We used to give a lot of training programs to for people to understand about the importance of that product.
Okay.
But after COVID, we got 3 lakh tins of order within no time.
3 lakh.
3 lakh tins of order we have received from North. So then people started understanding even this product you can find this leaf or plant on the roadside as well. It's called tippaku in Telugu actually. Okay, it's a very normal plant which you'll find everywhere. Okay,
but it had to be converted to an edible format.
Exactly. So that way, people started understanding about Ayurveda. People like products like Shilajit. People need Shilajit, Ashwagandha. So immunity boosters have become very, very popular after COVID.
So in terms of lifestyle, we've seen post-COVID is people are now moving more to natural products.
Yes.
Okay, it may be a fashion, but I think it's more to do with the way Indian medicine system has evolved, be it Siddha or Unani over the years, Ayurveda. So do you think there is now, as we look back at your journey, as you rightly said, from 750, maybe you will go to 1500 products, at least 1000 products and then move to 1500.
Yes.
But do you think the Indian way of living, we are now kind of living a stressful life. Maybe people want to bring down the stress a bit,
Yes.
eat more natural stuff.
Yes.
Do you think that understanding has come to the Indian consumer?
Of course, yes. If you take examples of myself, till COVID, I had a different kind of lifestyle, and after COVID, I have a different kind of lifestyle.
Okay.
I started consuming my supplements every day today. That's where it's keep me active every day.
Wonderful.
Okay, because there are a lot of supplements. I never used to use supplements before, let me be very frank, unless when I used to play sport, I don't use any supplements. Then after COVID, somehow my energies has come down drastically. So because I come to office by, like, let's say I wake up at 5 a.m., I do my yoga 5:30 to 6:30, 7:15 I'll get ready. I'll be there in office by 7:30 to 8 a.m.
Wow, that's early.
That's my schedule actually. And I used to sit evening till 8-9 p.m. Okay, but now these days, like last 1.5 years after COVID, I started, that energy is not coming in me. Then I started my supplements, and I'm again back to normal now.
So you needed that extra zing in you.
Of course, yes.
Wonderful. In fact, we could possibly go on and on, but the paucity of time, Dr. Narendra Ram, wonderful speaking to you, because when we last met, your portfolio was lot smaller, but then you have built it up over a period of time, and I'm sure you're ramping up your production facility and your R&D and your QC and others actually. But possibly there's a lesson for an Indian entrepreneur in what you're doing, because you didn't do something which others are doing. A lot of others are doing. You didn't try something to grow very fast.
Yes.
You didn't try the tricks of the trade.
Exactly.
But you grew with a concept in mind, and you kept growing on that. And that's a most wonderful lesson we can do. And of course, you would have had a lot of setbacks, but then you overcame all that. And that's a great thing. And bringing in sports, bringing in fitness, bringing in media, bringing in fitness, bringing in, again, coming back to natural forms of life in terms of products. I think that's a wonderful mix of things that you have in your bag. Thank you for speaking to us.
Thank you so much.
Thank you very much.
Thanks for having you here.
Thank you. Ladies and gentlemen, that was Dr. Narendra Ram speaking to us about his company Lifespan, but beyond it, speaking about the various ventures that he has within his group. And he has given us a detailed rundown of all that. Possibly for an entrepreneur or a startup looking to start business, these are hints of where they need to do, what they need to do. Thank you for watching. Jai Hind.